Hi, welcome to this video. This is Chad Clark from Physical Therapy Connections in Pueblo, Colorado. Recently, there was a male, it does happen to females, but a male gave us a question about what to do with groin pain, strain, just pain in this area. His happened to be because he lost his balance and basically ripped or tore the muscles in that area, is what it sounds like. So the question is, what do I do about that? One of the best things not to do is stretch it. So typically when someone injures their hamstring or groin, one of the number one things they're told is to stretch it. And that's actually one of the worst things you can do, because if it's already torn or stretched and you stretch it more, it's probably not going to feel that well because it's a muscle that's been literally lengthened beyond normal length. So stretching it usually makes it worse. So what we find is sometimes a person going into a narrow stance and just doing some basic weight shifts, even some rotation, which they'll feel some pull, but it's not like a direct stretch this way. So a narrow stance, of course, set yourself up for safety so you don't fall down while you're doing it, because that would not be good. And then you want to add some rotation. And then actually another thing, by going into a split stance and just doing like a mini lunge, which at a low level loads up the muscles in the surrounding areas and even the groin where it was torn or strained, and just doing some weight shifts back and forth will start to get some blood flow in that area. And it's all about circulation and hydration. So if you get circulation to that area in the most safe and pain-free way, that'll help heal it. As well as hydration by, if you're not drinking much water, definitely try to increase your water intake. That will help that whole area, hydration and circulation. I also have to say something about prevention, because if I didn't, I feel I would be missing out on a key component. He happened to lose his balance. We want to step back and go, well, why did he lose his balance? He might have the best balance in the world and things just happen. So in those cases, that's like 20% of the time, there's nothing he could have done about it. But let's say he could, we might want to check balance, and you would do just a simple, can I stand on one leg for 10 seconds, each leg, and have some pretty good stability. If you're all over the place with your eyes open, you want to work on that balance. That would help you prevent things like that, meaning you wouldn't fall and stumble and you're less likely to tear your groin. The last thing that I'll say, so there's three things: what to do after it happens, what to do to prevent it, and the third thing that gets brought up is like, well, should I ice or heat? Basically, either one is going to work, so you can alternate ice or heat in the earlier stages, because they're both going to help somewhat reduce the pain and inflammation. So work on prevention, the performance part, and then some quick little tips, hopefully with the ice or heat, that may at least calm that down. So hopefully that helps with the question that was posed by the mail to us a little bit ago, and hopefully it helps you.